Hi, everyone. Thank you for joining us this evening. Good evening to everyone. Today, we are talking about dry eye disease, one of the most common eye conditions out there, but also one of the most misunderstood. If you've ever dealt with blurry vision, burning eyes, or that gritty, tired feeling at the end of the day, you may already be dealing with dry eyes. Today, I'm joined by Sean, one of our experienced optometrists, and Prianka, our surgical services manager, who leads our diagnostic and treatment teams. So, Sean, what is dry eyes?
Well, dry eyes is a condition where you either not producing quality tears or you're not producing enough tears. Um, and the tear film itself, it comprises of three layers: the water layer, the oil layer, and the mucus layer. So within these three layers, if anything goes wrong, it tends to compromise the integrity of the tear film itself, causing more dry eyes. So irritation, inflammation, things like that. And more common thing we would see these days would be meibomian gland dysfunction. So the gland dysfunction is where the oil glands in the eyelids, they tend to get blocked or they start to break down.
So, Priyanka, what do most people overlook? Why do most people overlook these dry eye symptoms?
Well, Karim, it's actually really common and more common than we think it is. And it's so easy to overlook the symptoms because they feel mild and they're not always present, so they're intermittent, and they feel like everyday issues that you'd always be experiencing. So you might feel the eyes have a little bit of burning or a little itching. The eyes might be watering a little bit, but it comes and goes. So people don't really think they have a problem. They think, oh, well, I watch on the screen too much or on the phone too much, or just some allergies that, I might be affected by the dust in the air, the Sahara dust maybe, and they just leave it and they don't really bother to get it evaluated or assessed. And so by the time they come in, they think that they have these allergies or they just have like fatigue or tired eyes. But when we do the assessment, we actually realize that they do have symptoms of dry eyes.
Okay, okay. So, Sean, what will we as optometrists look for or see in our patients that will raise a suspicion that they have dry eyes?
All right, good question. So just going on what Priyanka said too, the vision itself tends to fluctuate. That's like the main one. And of course, that tired feeling, whether it's by mid-afternoon or at the end of the day, a lot of people say they have tired eyes. So it's not something to overlook. Also, in the exam itself, you might see, well, I might see some redness or lid inflammation or tear film instability. So those are the signs that would tell me that something is going on a little deeper. So at that point, I would normally refer back to Priyanka to do the dry eye assessment with the C-diag machine.
Yeah. CDIAG. So, Priyanka, how does your team use the CDIAG or CDIAG to assess dry eyes in your patients?
So I'm really glad that you asked this question because the CDAG is actually a pretty new machine that we have in our practice, and it allows us to do a more modern day type approach at diagnosing dry eyes. And the machine does this by analyzing the patient's tear film and also the meibomian glands, which Sean referred to earlier. So the machine will help us to understand a little bit better what type of dry eyes the patient has. And then it allows us to tailor the treatments a little bit better as well to the patients. So we don't just randomly say, use this particular drop because, we know a little bit more now because we have more information. And the analysis actually gives us certain key bits. So it tells us the tear breakup time. It gives us some information about the health of the oil glands or the meibomian glands that Sean referred to. And it talks a little bit more about key factors. So we could understand better what's happening. And the patients are also able to take a look at the glands in the eye because we get a little bit of a visual aid too. So they could see what's going on.
Okay, that's very interesting there. So Sean, we earlier we mentioned the meibomian glands and Priyanka referred to it as well. You know the meibomian glands would secrete the oily part of the tears. You can tell me what was the importance of that particular layer or that particular part of the tear film?
Yeah. So that oily layer, it acts as a barrier towards the atmosphere itself. So it would prevent evaporation of the tears itself. So it's not enough to be constantly producing tears. The tears also have to have a good quality to remain on the eye.
Okay, I see. So what would happen if somebody don't treat the dry eyes early or early enough?
It's a good question. Lots of people take dry eyes for granted, but it's actually a progressive thing. So if left untreated, it could cause chronic inflammation, discomfort, or even damage to the cornea in extreme cases. So it's not something that will go away on its own. It really tends to affect the quality of life. So we've had patients who had to avoid night driving and they struggle with screens, and then those who wear contacts is very difficult and uncomfortable for them. So really and truly, early diagnosis and treatment of dry eyes is crucial. And that's why, again, we would always refer back to Priyanka's team for this full assessment and proper treatment.
So what you're saying there is if I have dry eyes or I ignore the symptoms that I experience in, it could actually lead to something worse, something affecting my eyes or my eyesight permanently.
In some extreme cases, yeah. Best case scenario, it just reduces the comfort of your life.
Okay, let's hope it don't go to anything permanent. So so then you'll send them to Priyanka's team. So Priyanka, what treatment methods your team would offer, and how would they work, and how would they help the patients?
So the first method or point of treatment is usually just starting with the lubricating eye drops, which will help to give the patient some more comfort without anything too painful or any sort of other treatment. If that doesn't work, or sometimes we may combine it with other treatment, we then move to treating the glands itself. And to do this right now, we have our main treatment, which is called IPL or intense pulse light. And this uses some gentle pulses of light around the eye or along the eyelids to help to stimulate the meibomian glands and also helps to reduce inflammation. And that in turn helps the patient to feel a little bit more comfortable even after just the first treatment, as we've been seeing with some of our patients. And then it continues to gradually get better. It is a really quick treatment. So the treatment itself is probably just 5 minutes and it's non-invasive and it really is painless for the IPL to be done. Most times we just need to do about 3 or 4 sessions and we do them 2 weeks apart. So within a month, really, you could have your entire treatment done and you'll start to feel some relief just after the first or even the second treatment in some cases. So the goal is really for us to just be able to get the patient to a comfortable level where they're not feeling annoyed or frustrated by having the gritty feeling or the watery eyes or the blurry vision, but really to just reduce the need for being constantly on artificial tears. Now, we're not saying that you're going to be off of it, but you might have to reduce the use of it a bit and to have a better oil flow from the glands.
Okay, so just to clarify, IPL, intense pulsed light, right? Just clearing it up for the cricket lovers out there to mix up with with Indian Premier League. So we only doing
Definitely.
we only doing the intense pulse light on patients that the eye drops don't work on, or once they have a meibomian gland issue, we would do the IPL.
Once we notice that they have meibomian gland dysfunction or some type of evaporative dry eye, it would be suggested. In mild cases, if the patient is not really keen on doing the treatment, they might be okay with just doing artificial tears, but moderate to severe, we definitely would suggest doing the IPL.
Okay. So, Sean, just coming back to you a little bit there. When you have a patient who you think have dry eyes or you're diagnosed with dry eyes, would you also offer some treatment methods or treatment plans for them before sending them off to Priyanka?
It's a case by case scenario. So we as optometrists, we have our ways of assessing the degree of dry eyes. So the milder dry eyes would tend to be the regular rewetting drops. Sometimes may even have a warm compress to really help stimulate those glands there. And then the more severe dry eyes, where we think there's a risk of inflammation or damage to the cornea itself, we'd send them over.
Okay, so would you say like the majority of patients need to actually have the IPL, or you think like the ones that we see in the optical, would drop suffice for the majority of them?
Well, it really depends on the branch and the demographic of people. You'll find more of the people that work on computers, they tend to have more of an issue. So I would definitely send them across.
Okay, and what about things like compliance? Do you find like if patients who you would treat with drops for dry eyes, you find like they actually use the drops, or they just kind of use it two times or use it for a few days and then forget about it and then call or come to the clinic and say, well, the drop's not working.
Well, that's not just a Trini thing. That's a everybody thing. Uh, what we find is that patients would use the drops or for any kind of treatment, and as soon as they get some relief, they forget about it. So it's a common example of you forget what he was doing, you know?
Right, right. So they get relief today and then they forget about it until they have the issue again. So they basically only treating the symptoms, but not the cause.
So it is very important to follow through with the treatment itself, do the full course, because that way you prevent it from regression, or at least you reduce the risk of it.
All right. So Priyanka, can you share with us and our listeners real patient experience with the dry eye treatment at the clinic?
Yeah, so most patients, like, we know, they tend to not do formal evaluations and they tend to go and just buy something over the counter and self-treat. And so, without a formal evaluation or assessment, um, they'll find that even with the drops that they buy over the counter, they don't get sufficient relief. So when you assess the patient now and you tell them, okay, well, we notice you have a gland problem and we want to treat it, um, and be able to tailor your treatment to give you some more comfort. The patients are like mind blown because they didn't even know they had, glands in the eyes and all these things that produce an oil. So when we tell patients this now, um, obviously they get interested and they want to hear more. And then we tell them, okay, well, let's start with the treatment. And they all a bit worried because they don't want to put anything in their eyes or around the eyes. They're worried about what the lights will do. And then you kind of have to explain and take your time and explain to them what they're going to expect and the sort of comfort that they're going to be getting after the treatment has been done. So we had a patient and she was really not keen at first. So I asked her to go home, sleep on it, think about it. And she went and she did her research and reading and stuff. She came back, we started the treatment, and she was pretty happy even after just the first session. And she said she didn't even remember that she had to put her drops in because the eyes felt comfortable enough. So that's good for us to hear because, it means our treatment working. But we also need to remind her that the treatment itself still needs to be combined with the drops to get the best relief options.
Okay. So I see we have some questions from our listeners and viewers. So the first question for both of you, are there any natural methods to reduce the effects of dry eyes? Sean?
Well, yeah. That being, if you, well, like most Caribbean people, and you sleep with a fan on your face or you have the AC on, it's always good to either remove these things from the direct line of onto the eyes, or you could use a sleep mask to cover the eyes itself. So that's one way.
Okay. Priyanka, you know of any natural methods that someone can use?
I don't really have anything more to add to what Sean said, but I will just say, do not go putting honey in the eyes because that is not good,
Right.
I would
Yeah.
like to add to that, no dewdrop from the mango leaves, please.
right?
Right. I also had a patient who used lagoon rice and goat butter on the eyes to help with the dryness. That was a rather
It's a full
strange one for
meal,
me. Yeah, so she said it had to be lagoon rice and it had to be butter from the goat. And had the goat and the goat was apparently from her yard too. But we don't want to do those things because I mean the cleanliness and the sterility of it could cause way more problems than just dry eyes. Right? Sean, what about the 20-20-20 rule?
Yeah. So the 2020 rule is, well, the 2020 rule is a good rule that we optometrists use and is a nice play on our terms too. So what that really means is for every 20 minutes of nail work, we look above the screen or away from the screen for 20 seconds. So when I say look away from the screen, I mean into the distance, not onto another screen. So you don't go from the laptop to the phone.
Right.
And then ideally you should be looking 20 feet away. So that's where that 20-20-20 comes in.
So what I like to add to the 20-20-20 rule as well is a fourth 20, which is I tell the patients blink about 20 times. And just to kind of, mix back the tears, coat back the tears on the eye. I think that one would help a lot. I see on the chat somebody is saying castor oil, Sean. What do you think about that?
Castor oil is a rather thick oil, but you, you're thinking well in terms of the oily layer of the tear film. But our oils are much different from castor oil. So what you would most likely do is clog up the glands on the meibomian site, and I would have to refer you to Prianka.
So basically, they're going to make it worse. So, Priyanka, as the manager of the surgical services team, you could probably answer this one. Can a person develop dry eyes after cataract surgery?
Yes. Most times what happens is when we clean the eye pre-operatively, so before we start surgery, the solutions and stuff that we use, we actually clean out everything. So like, your natural oils and all these things get cleaned out nicely. And then the eye tends to feel quite gritty or gravelly or sandy after. So post-op, you feel this kind of gravelly sensation on the eyes. And it really is because the eye has become a bit dry. And so you may need to start on some lubricating eye drops just to kind of help to get the eye to a more comfortable level.
Okay. And Sean, will someone ask as well, can I just use drops without getting a dry eye assessment?
Um, it will depend on the situation, but it's always good to get advice from someone who could look at the actual symptoms and signs of the eyes itself.
Okay. All right. Um, a lot of patients, when we ask them, if we mention dry eyes to them, they might also say, well, no, my eyes not dry, my eyes water a lot. What you will tell your patients about that, Sean?
So that's actually a sign that the eyes are dry, and that's due to an overcompensation. So remember in the beginning, we said that you either don't produce enough tears or the quality. So in this case, the quality of tears is poor. So the eye is trying to produce more to constantly keep the surface wet. So it is a definite sign of dry eyes.
All right. Um, Someone also said on the comments that they would put a warm compress every night to deal with the dry eyes. What do you think about that one, Priyanka?
I think that's a nice way to start treatment. However, I also know from patients telling me that they try using the warm compressors at home and it's not always very effective because the wash rag that they might be using, it tends to cool off pretty quickly, so they don't get that constant heat on the eyes or the eyelids. And so it doesn't really help a lot. It might help a little bit, but it's not effective when you do it at home. So you need to maybe try, and a patient did tell me using some warm rice in a sock held the heat better for longer time. Some of them use even potato slices instead of just using the wash rag. And the other option is you could just get a heating pad, which is probably more sanitary. But it depends on your situation in terms of also finances, right? So a heating pad online, you could probably just get that and use it for a constant period.
Okay. So I would assume that the way in which they're doing the warm compress on the eye at night is what would matter in if it's actually effective or not.
Yeah,
Correct.
sure.
Sure. Go ahead,
Yeah.
Sean.
So yeah, they are the gel eye masks. And the way that you're doing it would also be effective. So the thing to remember with these types of treatments, you don't want to go too hot because the skin on the face and at the eyes especially is extra thin. So it's very easy to burn things there. So you want to try and keep as much warmth as possible there for a long period of time.
Okay, I think I was doing some research sometime and I was saying that at least 10 minutes of warm compress. But I would also like to tell the patient if they choose to do it at home, to give it a massage while they're doing it as well. To sort of, kind of push the oil as clogging the glands to be able to sort of to flow up and open up the glands. Yeah. Priyanka, is it only older people that would get dry eyes?
I mean, it's not limited to older people. We actually have noticed throughout the clinics that a lot of younger patients are coming in as well. And we are kind of alluding that to the use or increased usage of these screens. So I think since COVID and post-COVID until now, we've had a lot more screen use. And staring at these screens means we blink less as well. So we have that dry eye issue in that regard. Then we also have a lot of younger people using contact lenses, which Sean mentioned earlier as well. And then the cosmetic products that could also contribute to dry eyes. So it's not just older people, but still a nice number of younger people coming in with the symptoms as well.
Okay, so just one last question for each of you before we close up. Sean, do you have dry eyes?
Yes.
Priyanka, do you have dry eyes?
Yes, I do.
And I definitely have dry eyes as well. So I mean, that just goes to say we're fairly young and we all experience dry eyes. And the majority of our work is seeing patients, interacting with patients, also a lot of computer work, a lot of screen time. And the majority of people our age, our generation tend to be on digital devices as well, whether it be the computer, whether it be the phone, and even younger than us, they're always on the phone and we stare and we don't blink. And I think that's something that's important. That's why adding the 40-20 to the 20-20-20 rule is to remember to blink. Yeah. So in closing, I want to thank Priyanka and Sean for giving us a very informative session today. And dry eyes is something that is simple. It's somewhat easy for us to treat, but it's also forgotten or ignored by a lot of patients. And oftentimes when we see them in clinic, it takes a lot more to treat it because they sort of come in the end stages and the later stages of it. So the takeaway that I would like our listeners or viewers to take away today is that dry eye disease is a real disease. It is very, very common. 3 out of the 3 of us right now on this video has dry eyes. And it is very treatable. So if you're dealing with tired, blurry, irritated eyes, the eyes are burning, the eyes are itching, the eyes are watering, you're feeling a sort of grittiness or gravelly feeling in the eyes, don't ignore it. Come in for a dry eye assessment today or tomorrow. um, come in for a dry eye assessment. Book an appointment with the optometrist. The optometrist, we are all capable of diagnosing and treating to an extent the dry eyes. So book an appointment. We guarantee you that we would get to the root of the problem and help you feel better long term. So book an eye exam at Trinidad Eye Hospital, Optical, and we are here to help you, to help your eyes feel better and to help you see better. Have a wonderful evening, everybody. Thanks again, Priyanka and Sean, and make sure and treat your eyes. Yeah, treat your eyes well, because eyes are definitely important for all of our independence. And we don't want something as simple as dry eyes to lead to something permanent and affect your eyes and affect your quality of life. Have a good evening, everyone. Take care.